Do you have a nurse's bladder? Stay tuned to find out. Hey everyone, and welcome back. In today's video, we're going to be talking about nurse's bladder. So what does it mean exactly if you have a nurse's bladder? Well, it really describes just anyone that's able to hold onto their bladder for very long periods of time without going to the bathroom. And it gets its name obviously after the nursing profession because typically nurses work a 12-hour shift. And there's many nurses who will go literally their entire 12-hour shift without going to the bathroom even one time. Now, to give you at least a better idea, depending on how much you're drinking during the day, it will vary from individual to individual. But typically we will get the urge or desire to go to the bathroom once every 4 to 5 hours, sometimes as often as every 2 to 3, and sometimes as little as once every 6 hours. But again, it's going to vary depending on how much you're drinking, but typically speaking, you should be going to the bathroom once every 4 on average. So a nurse to hold it in the entire 12-hour shift is crazy. That's about 3 times the amount of time you should be waiting to go to the bathroom. So why does this happen? Why do we call it a nurse's bladder just because you can hold on to it longer? Well, when you're holding on to large amounts of urine for prolonged periods of time, the bladder will actually distend. So the bladder is normally in a collapsed position. And when it fills up with urine, it will expand and it can stretch to hold really large volumes of urine. But for nurse's bladder, what tends to happen is that the bladder gets over distended and it puts someone at a lot higher risk for having leakage. It can cause other symptoms like having a lot of pain in the lower abdomen. It can lead to urinary tract infections, and it can actually cause kidney damage over time. So it's not to say that nurses are just holding on to it because they really don't need to go. A lot of them are just suppressing the desire, even when they know they really should be emptying their bladder. In one study that was done, I believe in the 1990s, a Danish physician did a survey and observed that over 70% of nurses suppress the desire to go to the bathroom during their shift. And this is very, very common. A lot of nurses that I worked with would tell me that they would sometimes go their entire shift every day during the week without going to the bathroom a single time. And it's not because the workplace was not allowing them to take bathroom breaks, or it's not that they didn't really need to go. A lot of nurses they were just so busy. They were taking care of their patients. There's call lights going off. They're just being pulled in 20 different directions all day long. And they essentially just push it to the back burner of not needing to go to the bathroom. So again, it is very important to understand that you really should be emptying your bladder regularly to avoid the risk of UTIs. Urine is a waste product, and so even if it's a small amount of urine, when it's left to sit in your bladder for very long periods of time, it can lead to a lot of urinary tract symptoms. So it's very important we are going to the bathroom regularly. It is commendable that nurses are putting obviously their patients' needs and all of the things that they're needing during a typical day before their own needs. But when you have a condition named after you, you know that something's wrong. We need to do something about it. So again, it is very admirable that nurses will put others' needs before their own. They really are, doing an amazing job in thinking about their patients' goals and needs before anything of what they need. I know a lot of nurses that will give up their lunch breaks and any of their rest breaks just to be able to take care of their patients better. So again, it is very commendable, but having a nurse's bladder is not necessarily something to brag about. But again, typically nurses are able to hold on to it for much longer periods than the general population. So again, generally speaking, we should be going to the bathroom once every 3 to 4 hours, depending on your fluid intake. You might be able to stretch it for a little bit longer period, but holding it in for 12 plus hours is definitely along the lines of a nurse's bladder, and you really should be trying to find times during the day where you can go to the bathroom. So again, nurses, it's very commendable, but go to the bathroom more often. All right, if you enjoyed this video, like, subscribe, and share, and we'll be back soon for the next one.